7 causes for a false positive pregnancy test. Overview. Home pregnancy tests are a common tool utilized to discover if you're anticipating. Many at-home pregnancy tests are dipsticks. They are placed into a urine stream. The stick is then able to identify human chorionic gonadotropin, HCG. This is a hormonal agent produced during early pregnancy. Some pregnancy tests identify HCG extremely early in pregnancy. Respectable home pregnancy tests can be extremely precise, however they aren't foolproof. False positives and negatives can take place for a range of factors. It's also crucial to keep in mind that as soon as you have a positive pregnancy test, see your medical professional to start early prenatal care. This video will give you more information about the reasons behind false positives on home pregnancy tests. 1. Chemical pregnancy. It's possible to have a positive pregnancy test even if you aren't technically pregnant. This is called a false positive. It's in some cases triggered by a chemical pregnancy. A chemical pregnancy occurs if a fertilized egg, called the embryo, cannot implant or grow very early on. This can take place for a vast array of factors. Early pregnancy loss does not take place because of anything the woman has done. It might be the result of issues within the uterus, such as fibroid scar tissue, a congenital uterine anomaly that triggers an irregular-shaped uterus. Low quantities of particular hormones, such as progesterone, can lower the probability of implantation and embryo growth. Some reasons for a chemical pregnancy are unknown. Chemical pregnancies are believed to be extremely common, but they typically go unnoticed if a pregnancy test isn't taken. These early test outcomes, when incorrect, can be emotionally draining pipes. For that reason, it's suggested you wait to utilize an at-home pregnancy test up until 1 week after you anticipated your period to begin. 2. Ectopic pregnancy. In some cases, a fertilized egg can implant itself beyond the main cavity of the uterus. This causes an ectopic pregnancy to take place. Ectopic pregnancies typically occur if a fertilized egg gets stuck in a fallopian tube throughout its journey to the uterus. This type of ectopic pregnancy is likewise known as a tubal pregnancy. The following might cause an ectopic pregnancy: scar tissue or inflammation in the fallopian tube, misshapen fallopian tube, a history of past uterine infections. Ectopic pregnancies can also take place in the cervix, ovary, or stomach cavity. An ectopic pregnancy can't continue to become a regular pregnancy. The embryo isn't practical, since there's no location for it to grow or thrive outside of the uterus. The embryo will still produce HCG, although it has actually been implanted in the wrong place. That can trigger a false positive reading on an at-home pregnancy test. Ectopic pregnancies are medical emergency situations. Ectopic pregnancies can be damaging to the woman if left neglected. Extreme blood loss or loss of the reproductive organs can happen. Symptoms of ectopic pregnancy consist of nausea and sore breasts, which are likewise signs of a normal pregnancy. Sharp waves of discomfort in the abdomen, pelvis, shoulder, or neck. Serious pain on one side of the abdomen. Light to heavy vaginal spotting or bleeding. Dizziness or fainting. Pressure on your rectum. Seek instant medical assistance if you presume you have an ectopic pregnancy. 3. Recent miscarriage or abortion. You might continue to test positive for pregnancy following a pregnancy loss, either through miscarriage or abortion. During pregnancy, HCG levels continue to rise as the placenta grows, doubling every couple of days and peaking at around 10 weeks. When a pregnancy ends, HCG levels begin to decline, however it's a slow procedure. The hormonal agent can stay in your blood and urine for up to 6 weeks following the end of the pregnancy. It's possible to have a false positive test up until your HCG levels return to their pre-pregnancy state. If the miscarriage was spontaneous, it's also possible that not all of the pregnancy-related tissue was gotten rid of. This will cause HCG levels to remain raised. When this happens, a minor surgical procedure called a dilation and curettage, D&C, is typically needed to eliminate the tissue. 4. User error. Like most things in life, at-home pregnancy tests aren't foolproof. It is necessary to follow the package instructions precisely. Inspect the expiration date prior to utilizing the test. Even with these safeguards, user error can happen. Among the most typical errors is taking the test too early during your cycle. This can trigger either a false negative or a false positive. It's also essential to use the test when your urine isn't watered down excessively with water. Use the test when your urine is very focused, like when you first wake up in the early morning. Leaving the dipstick in your urine stream for the exact quantity of time designated is likewise crucial. Think about setting a timer on a stopwatch or your phone. That can help you track for how long the dipstick has been in your urine stream. You'll wish to use a timer once again while you wait on your results. Checking your outcomes throughout the result time span is also crucial. 5. Evaporation lines. Often an evaporation line can be mistaken for a positive pregnancy test. Some at-home tests reveal 2 lines when HCG is spotted and 1 line when HCG isn't discovered. The lines are typically a bright color, such as pink, red, or blue. Sometimes, a faint-colored second line will appear. This line might represent an early pregnancy or it might be an evaporation line. It's most likely an evaporation line if the line is totally colorless. Evaporation lines may show up on a test you see after your urine has vaporized totally. Often they're caused by hormone levels that don't represent pregnancy. The very best method to prevent being confused by an evaporation line is to follow the test's timing instructions precisely as they're provided. 6. Medications. If you're attempting to become pregnant under a medical professional's care, you may be taking fertility medications. Among these is the synthetic HCG trigger shot, sold under the following brand: Novarel, Pregnal, Overdrel and Profarci. The HCG shot assists roots release mature eggs. It may cause a false positive reading on an at-home pregnancy test, especially if the test is taken too early. Other medications can likewise cause false positive pregnancy tests. They consist of but aren't restricted to anti-anxiety medications, like diazepam, Valium, or alprazolam, Xanax. Antipsychotics, such as clozapine or chlorpromazine. Anticonvulsants, like phenobarbital or other barbiturates. Parkinson's disease medications, including bromocriptine, Parlodal. Diuretics, like furosemide, Lasix, Diascreen. Antihistamines, including promethazine, methadone, Dolafine. 7. Certain medical conditions. Seldom, specific medical conditions can trigger a home pregnancy test to give an incorrect positive. These consist of urinary system infection, kidney disease that triggers blood or leukocyte in the urine, ovarian cysts, particularly corpus luteum cysts, more major diseases such as ovarian cancer, pituitary issues, really rarely. Next actions. A favorable at-home pregnancy test result needs to always be followed up with a physician's consultation. Your physician might offer you a urine or blood test to confirm the outcomes and monitor your HCG levels. You may likewise get a transvaginal ultrasound to search for the gestational sac as verification that the pregnancy is proceeding normally. If you've received a false positive, your doctor's visit will figure out that. It might be an incredible relief to learn you're not pregnant. But if you were thrilled by your early results, it can be very upsetting. Keep in mind that incorrect positives do take place and aren't an indication you'll never ever get pregnant. If you've been trying unsuccessfully to get pregnant for some time, especially if you're over the age of 35, think about dealing with an infertility specialist. There are also support systems where you can find motivation and get knowledge from ladies who have actually been through the same thing. Working one-on-one with a therapist, member of the family, or trusted buddy can likewise be beneficial. Thank you for watching.